Now it's back. I think you guys can start once we hit 200.
That's what I think we're doing. Let's wait for three more people.
I have a patient at 6:30, so we need to wrap up before that. I'm just saying prior.
No worries.
Okay.
Okay, great. I think we've hit the magic figure. Do we want to start? Is everybody ready? Dr. Prem, Dr. Anjali?
Yes.
Great. Dr. Prem?
Yeah, I'm here.
Great. Okay. So good evening, everyone. Thank you for joining us today for this webinar. If everybody could please mute themselves throughout the session so that it is not a distraction to our panelists, that would be really great of y'all. Make sure that y'all are muted. It's at the bottom of your screen. So if by human error it you miss it, please make sure that you mute it. I can't keep muting everybody again and again. So yeah, so today we are celebrating World Senior Citizen Day, and to mark that, International Services has decided to hold this webinar on the art of aging. What we're planning to get out through this webinar is basically the tips and tricks from the experts. We have Dr. Prem and Dr. Anjali on the panel who have extensive experience with geriatric patients and geriatric health. So yeah, so let's, without wasting any more time, since we all have things to do after this, let us get into the webinar. So Kathleen, I'll hand over to you.
Yeah. Good evening, guys. It gives me great pleasure to introduce our first speaker today, who is going to talk to us about all things geriatric. Dr. N. Prem, consultant geriatric medicine, elder care specialist, founder and head, Department of Geriatric Medicine. He completed his MBBS from MGM Aurangabad and MD in Geriatric Medicine from Amrita Institute of Medical Science, Kochi. He is an ex-assistant professor of Department of Geriatric Science from All India Institute of Medical Science. He has an experience of 8 years in the field of geriatric medicine. He also started the first Department of Geriatric Medicine in South Mumbai. His areas of interest include the geriatric syndromes, dementia, urinary incontinence, orthogeriatric, and perioperative care for the elderly. Ladies and gentlemen, please join us in welcoming Dr. Prem.
Thank you. Thanks for having me here, and I thank the Rotaract Caduceus for this. And of course, it's a very, very significant day. There are 2 days which are very significant as far as old age health goes. One is, of course, the World Senior Citizen Day, which is today, and one is the International Day of Older Persons, which is on October 1st. Make no mistake, senior citizens never want to be called senior citizens, although the day is very important. But yeah, I mean that's the general notion, and they also don't want to be called forever young, because they believe that aging well is the key. I mean they don't really want to get younger, but they want to age well. So I would be talking an overview on geriatrics and also let me break down it into very simple words, because I mean, I'm talking, of course, to, I think, an MBBS student clientele, if I have to call you, after a long time. And I think the last one I did when I was doing lectures for MBBS students, which was in Amrita. So that's been a while. So, I mean, the topic is very close to my heart because everything geriatric is what I would want to tell you. Let me just put it with a bit of tips as far as how you should deal with older people, and also something about COVID. I'm not going to go too into COVID because I don't want it to be only about COVID. So I'm just going to share some slides. I mean, these are just for you to know. I'll just share it just one. Yeah, I hope you can see my slides.
Sir.
And see your slides.
Okay. So yeah, so elderly care is what we are going to talk about. As we know that the context today is very much through COVID-19 and lockdown. The susceptible group is supposed to be the older people and the children. But what is important for you to know as basics is what is elder care, what is geriatrics, who is the geriatrician, what is the geriatric assessment, why should caregivers and children be worried about our elders' health, general problems which are faced by older people, what are the signs which are important, and a bit brief, how do you want to take care of your older people during COVID situations? And now that the movement is restricted, you as the younger generation need to make sure that the elderly are occupied. And very important, which I never try to avoid, is about caregivers. Now, as you know that we have all opened up, the lockdown is like sort of gone back. But remember one thing, nothing much has changed for the older people because they haven't really got out of the house. Like I know one of the senior citizen association chiefs who has not stepped out of the house for the last 150 days and counting. So that's like you can imagine not going out of the house at all. So introducing you to the world of elderly care. See, why are the elders most susceptible to most diseases? Now, one is because they have a low physiological reserve. So, as you know, in your first year MBBS, you must have talked about physiology. So, biological changes obviously take place with aging. So, you have to remember it's not only age as a number. We are talking about aging organs here. So, multiple diseases. Yeah, if the older person is lucky, they wouldn't have many diseases. But when you have one disease, you usually have, for example, a diabetes, a hypertension, a dyslipidemia, you might end up having a coronary artery disease, a stroke. So all these things unfortunately come together. So that puts them into an absolutely susceptible category. Then, of course, something known as immunosenescence. Immunosenescence means the aging and the fading immune system. So the ability of the front line of our body, that is the immune system, to actually fight with microbes, and this becomes much, much difficult as we get older. So that is something we need to see, and that's why they are a vulnerable group. But that doesn't mean that they are something that we always feel no, something will always happen. So you should keep that in mind as. And another thing why elder care is important is, let me tell you, it should not be because you know older people at your home. It's because ultimately this is a life cycle, and you should learn about elder care for your own self, because everybody is going to get older at some point of time. Now, the challenges which older people in general have faced during this time is, of course, handling social isolation, handling emotions, focusing on facts, rejecting rumors and theories. And we have had an issue in recognizing mental health problems, especially in near and dear ones. By we, I mean not doctors, we as caregivers have found it very difficult because a lot of older people do not try to open up immediately. Now, I think this is one of the most important slides because at this age, we should know how to communicate with the older people. Very important is initiate communication by connecting with them physically and emotionally. This is going to be in a normal time because, of course, physically might not be possible now, but emotionally still possible. Always and always establish and maintain eye contact. It is powerful form of non-verbal communication. Always use the person's name when you speak to them. I mean, we tend to tell them Baba, Dada, Dadi, or things like other things. Baba ji, aap kaise ho? No, they still have a name. So if that is this particular name, so and so, then you should try to call them because that is something they recognize themselves. Always be patient and compassionate. You will only get a history, you will only get a talk from elders if you be patient. If you are aggressive to them, they'll shut down and you will not get anything and you will not be able to treat them as well. Ask questions instead of ordering them around. They shouldn't feel that you are just saying ye karna chahiye, wo karna chahiye. No. You should be more of use yes, no questions, because sometimes it becomes very difficult for them to comprehend if you make it very complicated. And very important is, please learn to be an active listener. That is the world of geriatrics. You have to listen a lot, and then only you'll be able to comprehend what they're trying to do. Now, what is geriatrics? Now, let's come to that. Geriatrics is basically a specialty in which we are only taking care of the health care and overall health, which could be health and disease, a holistic way. That is the medical. I mean, how is health defined? Health is defined as a physical, mental, and social well-being. So we are trying in geriatrics. We try to take care of the entire gamut. Geriatric age group: there is a young old, there is a middle old, there's an old. So the young old is 60 to 69, middle old is 70 to 79, and old is above 80 years. And we expect, as we get as healthcare is going on, the old should be pushed more towards 100 years. Why do you have to understand geriatrics? Is because no elderly is the same. Now, the great Ignacio Lasher, he's the one who coined the word geriatrics. He was like, if pediatrics is going to be separate for children, then why not geriatrics for older people? Because this is a separate group which needs specific care. Now, terms like homeostasis. Now, homeostasis is actually the body's balance to tackle anything external. Now, in an older person, the homeostasis gets a bit deranged, and the ability of the body to tackle situations, whether it's actually medical situations or other situations, mental situations, becomes more difficult. Then multiple morbidity, that is multiple diseases. And very importantly, I mean, you can have all the books of the world, but geriatrics, the disease presentation can be very atypical. Like how is it atypical? For example, a person can just come in delirium and he can have a lower respiratory tract infection. A person can just come in delirium and have a stroke. A person can just complain of generalized weakness, and we always think organic TB, cancer, and it can be purely depression. So everything becomes very difficult to interpret, but that's the key of geriatrics. You have to break it down and try to take history in detail. And who is a geriatrician? Now, a geriatrician is actually a specialist or an elder care specialist who deals only with senior citizens or older people above 60 years of age. One is about their overall health along with their aging changes. So we keep aging changes in mind. And ultimately, what is also very important is that you should keep in mind is their treatment preferences, because not all older people will be wanting only one kind of treatment. Now, it's not me who's talking about it. Even WHO has been talking about it. Every older person is different. So some might have the level of functioning of a 30-year-old, whereas some might require full-time assistance for basic everyday tasks. What is most important is we as providers, healthcare providers, have to give them a proper health. So health is most crucial how we experience old age. And what influences factors as far as old age is concerned? One is, of course, the individual, that is within them, the behaviors, which could be smoking, drinking, it could be their lifestyle, it could be what they've been eating, diet, it could be the amount of exercise they do, the amount of stress in their life. Age related changes always, because all the organs are getting old. Genetic, certain diseases which will have genetic preponderance. Of course, if you have a line of diabetes in your family, then it becomes more and more important that they are screened. Disease, the lesser the disease, the better the health. The more the disease, the more difficult it gets. Then environment. Now the environment is very important. I'll give an example. Housing. It's about a older person living in the first floor, no lift, having very bad knees. Now that is a concern for me because there is no lift, so they have to take 2 flights of stairs, and that might end up them doing it with pain or them not going out at all of the house, which can lead to a lot of other things. Then assistive technologies. Now we as healthcare providers should always make them realize that assistive technologies are not making them a burden, because they keep thinking that if I use a hearing aid, if I use a tripod, if I use a stick, if I use a things which help me, it makes me weaker. No, we have to emphasize that that makes them stronger. Then transport. Now, transport is very important because everywhere, even if you world over, there is a separate geriatric friendly transport. It is coming to India. I wouldn't say that I'm entirely convinced that it is in. Social facilities. Now, this is where the COVID has really hit the older people a lot, because the fit elderly would love to go to their gymkhanas, they would love to go to their clubs, they would want their friend circle, they would keep them absolutely busy. The biggest silver lining of this particular COVID time is, I think, everybody has become technology savvy, even the older people. And then we at graceful living also do a lot of support group activities for older people. Now, what are the general problems faced? Now, entities which are geriatric syndromes. Now, these are syndromes which are usually seen only in older people, include delirium, which is an acute confusional state. Dementia is memory problems. Not everybody with memory problems has dementia. Depression, again, easily missed in older people. Falls, there's remember, a fall happening can lead to a fear of fall, and the older person shuts himself or herself down completely. Frailty is purely a geriatric syndrome. Sleep problems, malnutrition, yes, it occurs in older people as well. Pressure sores, one of the worst things, one of the biggest nightmares an older person can have. Urinary incontinence, again, has a big taboo. Imagine an older person stops going out because they are worried they might soil themselves in public. Then constipation, again, very, very common. Now, the things that matter as far as older people concerned is sometimes the attitude of the elderly themselves. Oh my God, I am old. I am 60 years old. Pre-retirement, they're all fine. Suddenly they're like, no, now what will happen? What will happen to my health? So nothing really changes. It's just one day, but their attitude might be different. Attitude of the relatives. We as caregivers are very nice, very lovely, but then sometimes we ourselves try to stop them. Like a homemaker who has cooked all our life, you'll be like, no, now I am there. We have servants. Why do you have to do it? So you are actually stopping them from doing something they like. Treatment challenge is always difficult because you are taking care of medicine, you are taking care of the age related body changes, and you are taking care of that interaction. Social issues, geriatrics is never incomplete without that, complete without that, because social issues like lack of family, lack of caregiver can really make your treatment very important. Then cancer palliation and geriatric syndromes. Now, cancer and palliation is very, very important. End of life care is again important. We have to take some very tough decisions. For example, painful condition, end of life, again sedating the patient where they will not be able to recognize their own family members. Then challenges include multiple diseases, and the beautiful thing in allopathy or in any other medicines, that is the drugs. Now, more the drugs, the worse can be the side effects as far as older persons are concerned. Now, what are the signs in older people that we need to pick up? Things like weight loss, things like them having multiple drugs which causing side effects, constant pain, a loss of appetite, immobility. Now, I hate my older patients actually be away from, be more closer to the bed and less mobile, because more they are towards the bed, the more worsening they can be. Suddenly withdrawing, and generally very active older person just suddenly withdrawing and not really participating in a lot of things that he or she used to do. Memory problems, again, more and more people are getting educated about it, and they are doing well to come up to us to actually do their memory testing. Low mood, anxiety, again, should be picked up early because later it can be full blown depression. Recurrent urination, again, a lot of older people think it's a part of normal aging. It's not. Altered behavior. Dizziness, again, one of the common symptoms which an older person says. It can have multitude of causes. And the most important key in old age is independence. Now, if an older person loses independence, imagine yourself being dependent on anybody else even for a day. You obviously feel a lot of lack of confidence, and that doesn't work with an older person. Now, why are we worried about these issues? Because once the quality of life worsens, it increases disability, and then it triggers the cascade of dependency. Now, that is something I, as a geriatrician, and we as people taking care of old people, are always worried about. Now, why is geriatrics important? As I told you, if you look at the wheels of life, everybody is going to go through these phases, and most older people are happy till the scooter. Now, more so, even the wheelchairs are even technologically advanced. So, a lot of older people enjoy that as well. But this is how everybody goes through, not maybe till the wheelchair, but at least till the independent van, which everybody might prefer. Now, how do we assess older people? Now, that is something known as a comprehensive geriatric assessment. Why? because an older person's health is never only on the physical part, it is on the mental part, functional, how independent they are, the social side of it, the environment. By environment, I mean home and outside. Home, very important. What type of bathroom they have, what type of commode they use. These are all very important things. Whether they have anti-fall measures at home or not. If they fall, then who is going to be the primary caregiver? Then the cognition, very, very important. Whether they need a caregiver, whether they can take their own decisions. Effective assessment would include the detailed assessment of their anxiety, of their depression. Then nutritional and physiotherapy. I think as far as geriatrics is concerned, is always a team approach, so a multidisciplinary approach in which a nurse who's trained in geriatrics, a physiotherapist, a dietitian, and plus other team members which include maybe plus minus a dentist, an audiologist, somebody taking care of their ENT, and somebody taking care of their vision. So it's like different specialists might be needed because ultimately, as a geriatrician, you need to be the team leader and take care of all this assessment. Now, how do we age successfully? What an older person loves is they are able to manage their own home and where they live. They have a maintained their life and sense of self. They are able to optimize health. And if they are in trouble, they can enable their support team. So this is what independence is. This is what successful aging is as far as older people are concerned. Now, the three pillars of successful aging include something known as selection, optimization, and compensation. Now, we keep talking about what we cannot do. So, with older people, we try to tell them they should focus on what they can do. So, that's how you select. Make those things that you can do stronger and try to compensate for things you cannot do. So, that is how successful aging